COVID cases are on the rise in Guilford County, but health leaders say it's not like what we've seen in the past.
Yeah, they say they're keeping a close eye on levels ahead of respiratory illness season, but say severity concerns are low. WFMY News 2's Giselle Thomas spoke with experts about the latest COVID strain and its possible impacts.
The COVID subvariant Iris, or EG.5, is now the most dominant strain in the United States. It is a branch off from the Omicron variant and is responsible for more than 17% of cases across the country. As COVID slowed earlier this year, the state stopped tracking many metrics like daily case count. Instead, they now rely on hospitalizations and this map. It monitors the wastewater in North Carolina. An expert tells me the map measures two things: that we are currently stand and how it's changing. Here in Greensboro, you'll see we are in the 60 to 70 percentile compared to High Point and Winston-Salem, which ranges between 59 and 20%. Now, when we take a look at how it's changing, Greensboro moves into the red category. You'll see with Winston-Salem and High Point with lower readings. Now, experts who work at the state level say COVID is here to stay, and they expect to see the levels going up and down.
And when we are seeing increases, we just really want people to be aware of that so they can take the appropriate steps to protect themselves and their loved ones.
The FDA says an updated COVID vaccine should be rolling out in late fall. Health experts say consult with your doctor on what's right for you. Here in Guilford County, a representative from the health department says they are still waiting for guidance on the updated vaccine. But for those older than 65, you may be ready for another shot.
People over 65 continue to be the ones that we want to make sure that they're covered and their immunity levels are at the level that they need to be, so they can receive one additional bivalent vaccine 4 months after they received one before.
Experts say this time of year is respiratory illness season, and COVID is not the only illness being tracked. The state reports just over 4% of emergency room visits in North Carolina were related to other viruses like RSV and flu.